I think about clinicians first and what they're tasked with. And they're tasked with taking care of our loved ones. And it's really up to all of us to help streamline their processes so they can focus on the most important thing to them, which is patient care. And 2D barcodes and RFID are two solutions that streamline clinician workflows that can really help. So by adding GS1 2D data matrix barcodes to all product labels, we can help clinicians reduce manual data input, more accurately track medications, and then reduce the potential for error. 2D barcodes are also important to clinicians because they have the ability to hold the data crucial to patient care. With 2D barcodes, clinicians don't have to manually type in the Latin expiration date, which is required by many hospital systems today. And that is a huge benefit. And think about how many transcription errors could be averted and how much time could be saved. It's really a win for clinicians any way you look at it.
Hello and welcome to the Next Level Supply Chain with GS1 US, a podcast in which we explore the mind-bending world of global supply chains, covering topics such as automation, innovation, unique identity, and more. I'm your co-host, Reed.
And I'm Liz.
And welcome to the show.
I just had a great conversation with Gwen Volpe from Fresenius Kabi. They're a healthcare company. They're utilizing both 2D barcodes and RFID to provide a seamless, frictionless supply chain for their customers, which in this case is really improving patient safety and taking a lot of manual legwork out for the clinicians that help all of us stay safe in hospitals. It was a really riveting conversation about how these initiatives with both 2D and RFID can help in the everyday world. Enjoy. Hey, Gwen, it is so great that you can join us today. It's so great to see you again.
Thank you.
First, let's just level set. Tell us a little bit about yourself and your role at Fresenius Kabi.
Well, first off, I'm really excited to be here, so thanks for having me. If you're not familiar with Fresenius Kabi, we're a global healthcare company that specializes in life-saving medicines and technologies for infusion, transfusion, and clinical nutrition. Our products are used to help care for critically and chronically ill patients. And my name is Gwen Volpe. I am Senior Director of Medication Technology at Fresenius Kabi and also a pharmacist. I lead a team of pharmacists that support our medication technology efforts here at Fresenius Kabi for RFID, data matrix, the unit of use, and other technologies and software that support clinicians' use of our products. We also manage some technology-associated partnerships. And one of our goals at Fresenius Kabi is to integrate technology into our pharmaceutical portfolio to really help streamline the medication use process for clinicians, minimizing the burden of manual processes that can contribute to human error.
And we've talked in the past about how much this really makes a difference now with all of the important medications that you have and all of the work that's done in hospitals. You guys just have such a great mission, and it's so exciting to hear and talk about all of this. You had touched on two things in that introduction that I want to poke a little bit at. 2D and RFID. There's a lot of conversation that we've been hearing in the industry, not just in healthcare, right, but in food, in apparel, about 2D, which 2D, just to kind of level set, is like a QR code, but there's lots of different kinds. And I'm sure, Gwen, you already said data matrix, but just a little bit of background on RFID, 2D, and what you're hearing in the industry about how those are being used today.
At Fresenius Kabi, we are committed to improving our products for our customers, making things easier for them. And our hospital customers are being asked to do more and more with less. And in turn, we feel like we need to do more and more for them. So our customers approached us to add RFID tags to certain products and to include a GS1 data matrix or 2D barcodes on the immediate package, which means the vial or the syringe itself, in addition to the FDA mandated linear code that we're already using, including the GS1 data matrix on other packaging levels to comply with DSCSA. So this is in addition to that. So to get a better understanding of what that means, well, let's start with RFID. So customers who have RFID, inventory management systems or similar, to track pharmaceutical products, they require tagged product for the systems to even function. So hospital pharmacies buy RFID tags and they manually apply them to all the medications they want to track. So think about that. Customers manually tag and encode hundreds to thousands of medications weekly, which is a really time-consuming and tedious process with the potential for error. And we can really help with all of this for our customers. And we can help also by tagging and encoding specific medications while the product is being manufactured to make our customers' journey frictionless. And that product portfolio is called Plus RFID, and it's in our line of pre-tagged, pre-encoded RFID medications utilizing GS1 standards. In terms of 2D, all pharma products contain a mandated 1D barcode on the immediate package. And when you scan a pharma product itself, the vial, the syringe, or an IV bag, for example, hospital systems extract the NDC from that 1D barcode to identify it. But many hospital systems require 2 additional pieces of data, the lot and the expiration date, so they can track expired medications or recall drugs more easily. So hospital clinicians and support personnel must look at the product and manually enter 2 very important pieces of data into various systems over and over again every single day. And so we can fix this. We all can fix this. Fresenius Kabi is helping by voluntarily committing to adding GS1 2D barcodes to all of our products, transitioning over the next few years. We started to roll them out in late 2022, and we're really excited to support the adoption of GS1 data matrix on our product labels.
That's a big undertaking to be able to do that and to enable the clinicians to actually do value added work versus just typing in information that's obviously available anyway in this different way. You had mentioned NDC. Can you just tell us what that is?
Sure. The NDC is a national drug code, and it's on every single pharmaceutical product.
I know from a grocery perspective, I never go to the grocery store the same now. Probably our listeners will never go into hospitals and not be right looking and saying, is there a 2D barcode, is there an RFID tag? And that NDC, that actually has a meaning and needs to be encoded into the information of the barcode. You implemented the 2D barcodes and RFID. Obviously, there's manual savings from the clinician. There's less error. So what are the benefits of implementing both 2D barcodes and RFID? And overall, how do they improve patient safety?
When I think about that, which is a big topic, I think about clinicians first and what they're tasked with. And they're tasked with taking care of our loved ones. They're asked to do more with less. Their workloads increase. They're burned out and emotionally drained. And it's really up to all of us to help streamline their processes so they can focus on the most important thing to them, which is patient care. And 2D barcodes and RFID are 2 solutions that streamline clinician workflows that could really help. So by adding GS1 2D data matrix barcodes to all product labels, we can help clinicians reduce manual data input, more accurately track medications, and then reduce the potential for error. 2D barcodes are also important to clinicians because they have the ability to hold the data crucial to patient care. NDC, which is National Drug Code, lot and expiration date in a much smaller footprint. They're easier to scan at any direction, and they can sustain minor damage and still be read. With 2D barcodes, clinicians don't have to manually type in the lot and expiration date, which is required by many hospital systems today. And that is a huge benefit. And think about how many transcription errors could be averted and how much time could be saved. It's really a win for clinicians any way you look at it. Pre-tagged products with RFID can also save pharmacy personnel hours of time, eliminating the tedious step of tagging each and every item they want to track and encoding drug information to identify the item. They also do not have to make the decision about where on the product to place the tag. I've been in facilities where there are job aids to tell pharmacy personnel where to place the tag on certain products for the best read performance. We know that there are differences in the read performance of RFID on different pharmaceutical products, and we don't use the same RFID tag on all of our products. We meticulously design our Plus RFID tags for optimal performance on our products for the specific medication it resides on. And validation of product data and reading occurs at multiple points on our production lines. And we also pre-test our RFID product inlays with ARC RFID Lab of Auburn University, and we post-test the finished product with the Axon Lab of Michigan State. And we do all of this because it's important for our customers to have high-performing products. And using GS1 standards to encode the medication data ensures that every tag is read the same way every time, accurately and efficiently.
That is amazing. And it's really cool to hear how you're doing pre and post testing just to make sure that, you're all making the right decisions and going the right way overall for patient safety. That's awesome. At a session during GS1 Connect back in June, you mentioned how your customers were a driving force behind Fresenius Kabi's implementation of both RFID and 2D. How do you think others in healthcare or other industries can keep their customers in mind when making that transition?
It's imperative that you visit your customers and see what's on their minds, really learn from them, ask them questions, see how they're using these new technologies so you can provide products that meet their needs. And healthcare is constantly changing. So you can't assume that what you're doing today is going to meet their needs tomorrow. So take the time to verify. We involved our customers from day one with RFID and 2D, and we continue to do so to ensure we're providing products that meet their needs.
I think that's such a great point is what problem are you trying to solve? It's that basic, because you know what they say about making assumptions, right? But really getting into what issues they're having and helping them solve that. That's so powerful, especially when you talk about hospital settings and keeping people safe. It's awesome. So Rita and I ask 2 questions at the end of every podcast. So let me start with the first. What is your favorite technology that you're using right now, either in your personal life or your professional life?
I don't think I have one particular technology that's my favorite. It's really anything that makes my day-to-day life easier.
Uh-huh.
And I love to try new things. And this seems so basic, but I just love automated home control. I always smile when I come home and Google welcomes me when my lights automatically dim. And then I really love how I can monitor so many things remotely. And it still amazes me because I remember when that was not the case. And which is why I have such a deep appreciation for how technology can improve people's lives, especially in healthcare, where every second matters.
Yeah, that's so cool. And it's so true. It's such a different feel, right? When somebody is welcoming you home and it's automated. It's so cool. It's so fun. The next to last question that we ask is, there's so much going on in the world from a technology perspective and so many other things. What blows your mind? Is there a trend? Is there a thought that just really fascinates you overall?
I think artificial intelligence is really amazing. Machine learning is creating this never-ending list of new applications. And what blows my mind is probably the sheer amount of it popping up every day. In terms of healthcare, I'm really excited to see the ways it can improve patient care and clinician efficiency. We want our clinicians focused on patients, not paperwork. And AI and machine learning can really streamline those processes and provide new insights, solve problems and challenges. It's in its infancy, but it has the potential to transform healthcare. And to me, that's really exciting.
So that is our time for today. Gwen, thank you so much for joining us and our listeners. I know we'll get a lot of information about 2D and RFID, and it's been great. Thank you so much.
Thank you for having me.
Thank you for joining us on this episode of the Next Level Supply Chain with GS1 US. If you enjoyed today's show, please subscribe to our feed and explore more great episodes wherever you get your podcasts. Don't forget to share and follow us on social media. Thanks again, and we'll see you next time.